Thank you for joining. In the spirit of time, I'm going to get us moving. So, welcome again. Welcome to Getting It On in the Intermountain West. If this is not the session you wanted to be in, you should stay. All right. So, to get us moving, young adults are experiencing a paradoxical public health crisis. While at the same time, public opinion largely supports young people having comprehensive access to information about their bodies, this information is being restricted from them. And at the federal level, the United States continues to go against public opinion, ongoing funding for abstinence-based programs, which have been continuously proven to be ineffective at establishing positive health behaviors, as well as meeting the objectives of establishing positive sexual wellness behaviors. And at the state level, we're seeing increasing restrictions to young adults' autonomy, particularly withholding information about gender, race, and sexuality, further distancing young people from their comprehensive autonomy. So as sexual wellness shifts and accessibility shifts across the country, there's a growing need for tools and interventions that can respond to this overlapping mosaic of barriers experienced by young people. Awesome, thank you. Yes. So I collected the data on nearly 2,000 young adults attending a major research university in the Intermountain West, this one. And we'll show you how, and we'll show you how young people are being impacted by this restrictive landscape. Additionally, I'll highlight a few community engaged interventions responding to the public health crisis of shrinking youth autonomy. My findings show that not only is progress towards reducing sexual and reproductive health disparities, which will probably acronymed as SRH throughout the presentation, not only is reducing SRH disparities possible for young people, it's also actively desired by young people in the Intermountain West. Okay, so let's take a pause here. What is the Intermountain West? This is a question that my cousins have thrown at me from a young age. Being from the Midwest, there's always been some sort of rivalry. What is the West? My cousins would love to ask, well, everyone's LDS there, so aren't you? Or questions about, wait a minute, you say I have an accent and pronounce big weird, which is true, they do, my little Michiganders. You also have an accent. Where do you do all that like fun snow stuff? On the mountain, yeah, that's right. So both as I work with reviewers and publish, but also just generally thinking about the context of this space. I come from a background working as a health educator for young people. I think it can be helpful to really make a working model that is tangible, because the terms that we have don't make sense, which I guess is an ongoing theme of this conference. Language is not adequate in representing lived experiences. And so when I work with young people who are advocating for better access or expanding sexual health education, we really try to get grounded on what this place is, as well as how those barriers and systems work together. So when I was in 4th grade, I had a fantastic teacher, Terry Black, who had us do this activity in a edible landscape. It was fantastic. You came with like a cookie pan, right? And then we would make cookies and then cut out the little corner of Utah And then you would place like rivers with frosting, and you would put like sprinkles to show the snow-capped mountains. And we used like Rolos to make the plateaus. And I really wanted to do that, but I also want to honor people's access needs. So we're not doing that. We're doing a digital version, but know that I'm always down to make one. And also that just thinking about young people in this area, it's really important to put put on your young person hat. Like, what did you need? What did you wish for? What did you not have? And also, where can you be that person for the young people in your life? So, given my background in public health, I would say that the edible landscape is possibly what got me into public health, because it showed me these interlocking structures, but also showed me exactly where I could navigate within those different areas. In particular, whether you've moved here in the past couple of years or you go back generations, making a landscape using the 5 buckets of our social determinants of health is a way that we can kind of see that this isn't just one system restricting access for young people and impacting their sexual health. It is an interconnected web. But I would like to say and like to think that there is some possibility that comes with this. So these buckets are education, health access, environment, and economic stability. Okay, so take a moment, think of the Western region as you know it. If it includes Ohio, that's okay. Objectively wrong, but that's okay. And for just a brief moment, I want you to try and remove the state barriers that come along with this. Borders aren't always the most effective tool to envision these trends in health, even though, of course, they are the structure that we live in. I think especially for young people, it can be a block for themselves. They're like, I am a Utahn. So just imagine a world without for one moment. So first, we would start with a piece of construction paper. It'd probably be sandpaper. And this represents our Intermountain plateaus, a region mixed with crimson sandstone mesas, granite mountains, vast basins, which establish a temperate, albeit arid climate in higher elevations and hotter temperatures in the basins. And when I work with young people, I like to, if food sensitivities are okay, we bring in Hershey Kisses because fantastic mountain. Or we do like cotton balls and then they put food coloring on them and then they make them into tall mountains. And we talk about imagining the mountain ranges of the Cascades, the Sierra Nevadas, and the Rockies as a hug around this place. I just love thinking about that. Also, in this region, we consider these our precipitation blockers. So a lot of the storms from the Pacific don't make it over here. But if anyone likes winter sports out here, you'll happily tell anyone that there's a little bit of a pickup in our less than Great Salt Lake right now. But typically, you can get a really fun amount of precipitation that goes over into the Rockies, giving this area what it is known for in its outdoor recreation industry. So we have these guys here as our built environment, and then moving into our social and cultural landscape. I think this is a good time working with young people to introduce the tenets of reproductive justice. Once again, using a tangible mindset. Reproductive justice was established by Sister Song, a woman of color collective, and discussing the idea of being able to have kids, the right to not have kids, and the ability to parent one's own kids in a healthy and safe environment. Talking about how not only is the ongoing impact of colonization making this region one of the most dangerous for Indigenous people, particularly femmes, girls, and queer people, but also establishing that there is still an ongoing wound here that we must address within our region. And in particular, I guess this is what my cousins know our region for, is the Mormon corridor. Although making up 1% of the faiths of the US, this is the most strong region. I would say that it's shifted a little bit in the past 10 years, but there are still many counties and places where upwards of 65% of the population are LDS. And I have students who come to our sex education classes and they're like, everything I've learned about sex ed is religious based. Like, I wish that my teacher had my faith. Maybe then we could talk about how Judaism has more genders. I'm like, yeah. And like just kind of talking about how an ongoing history impacts the education that they have, but also there are just like some values and experiences that we also need to be mindful of, especially young people who are coming from a place of honestly rage and grief that they aren't getting the information that they deserve to have, can often be like, let's go ham. Let's toss out that population and let's talk about all the things that we haven't had to have. But I think we need to embrace the nuance that comes with the history and legacy, because there's lots of embarrassment and shame and cultural messages that aren't addressed. And then also looking at this region, it is one of the least racially diverse across the country. There is a history of uplifting white and LDS birthing and sexual health abilities so that others would not have such ability. And I think for our students, it can be helpful just to acknowledge, like, what if I'm not supposed to be the person who's speaking at this moment? And also, what does reproductive justice look like for me and my family? Also in this region, it's a bit of a mixed bag economically. I think for our students, a lot of teens and young people work. You might have seen there's been recent news about how a large population of young people work in this area, and that can contribute to the barriers that they can get to medical care because they simply do not have the time. But I like to highlight with them, like, okay, think about these mountains, think about these plateaus. Like, it's not easy to cover, and we have these historical points of where folks have lived. But if you're in Summit County and your Planned Parenthood left 5 years ago, odds are you're gonna have to travel over an hour and a half to get any form of sexual health care. And what if you're 16? You don't have a car, maybe? You gotta take a bus, you gotta pay for the bus, and you gotta go to school? Like, how are we navigating all these barriers? And then as I work with folks who develop these interventions, how are we making our spaces accessible for these young people? Do we have maybe transportation waivers, or do we have at least a consideration of like, we will get you door to door? And it's been great to see some public transit infrastructure develop since then, but it is definitely a huge divide across the state, and especially more as you go into these less populated regions. Okay, so I just want to flick through some things about healthcare access. So you can kind of see a bit of a pattern when it comes to healthcare deserts. There are 6 outlined in this map. So it's lack of access to a pharmacy, a primary care provider, hospital, hospital beds, trauma center, low-cost health center. And even zooming further in to our specific region, this is where you start to see the darker the square is, the more of these barriers we have. So the darkest shade of indigo has all 6 of these barriers, and then a little bit lighter, 5 and onward. And I think you can definitely see points where this lines up, where places that Indigenous people have been forced to be as well as in areas outside of our urban cores. And then specifically looking at birth control methods. Here we have even more overlap within these regions. I wish I could have done like a interactive code and like put them all together, but I'm so sorry, I did not. I did a quick count of these instead. So we have 3 counties within this region that state no contraceptive access, 7 counties with limited contraceptive access, and more than 20 counties that report little contraceptive access. And then thinking about what type of care is provided. We have 4 states that restrict care for transgender youth, and then looking at only a few protective states. And it's tough because sometimes when we think about like the West region, when we have the coastal states added in, and I say states, but I mean the non-Cascade side of Oregon and the non-Sierra Nevada part of California, it can really shift what access looks for this region. And so really honing down on what care looks like. I have many students who talk about, I'm gonna go to Colorado for a ski trip. And it's like, how are we gonna go to Colorado for that ski trip? Wouldn't it be nice if you didn't have to go to Colorado to get that ski trip, which is actually an IUD. So when we look at our education, I think it's nice to come back to this one at the last part, because then you can see the actual physical barriers, the cultural patterns, and then the medical disparities, and then look at our education. Because I think the education is always kind of slammed onto us. And I don't know, for y'all presenting in the region, if you ever get the like, your sex ed is so bad, just as a general of where you come from. And it's like, yes, but there's reasons why it is that way. And it's not like there isn't anyone trying to change it. I think that is one of my biggest, maybe personal gripes, is that there is a sense of a lack of potential in this region. And it's obviously hard. I am a young person who's been doing this work since I was 15. And there's an ongoing grief of like, oh, okay, another school is protesting queer kids being able to put up pride flags. And that's the same thing that I was fighting for when I was in high school and when my friends were in high school, and feeling these ongoing trends. But what I look forward to is thinking about the potential of knowing that there are all of these barriers to access. How can we use young people's experiences, bring young people in, and really give them the care that they need, rather than focusing on what I guess we have a system that's so focused on harm reduction, especially for sexual health, that it can often miss a lot of the nuances that folks have. So I like to think that the desert is not barren. There's a fantastic queer conservation biologist, Jonathan T. Bailey, whose book, When I Was Red Clay, is on one of your tables. And it really inspired me recently because he talks about growing up within the LDS faith and understanding himself as a queer person growing up in like the southernmost part of the state. And rather than thinking of this desert, which I often, admittedly, the days get tough and it's hard to see where we're headed and there can feel like a lot of doom and gloom. It's nice to reconnect with that physical, grounded nature of this region. And he states that being born of the earth between mountains and desert was a source of great power. And I try, even when I'm not feeling the most hopeful, and when my Pisces moon is not kicking in, I try to think of how there is this great power within these intersecting barriers that we face. So Here are some young folks. I go on to describe more from Jonathan Bailey's work. Sorry, it just really gets to me. I didn't need to define what parts of me were female and which parts of me were male, fractionalizing my identity until it could be shattered. I could simply be and be kind, love this world because I belonged to it. I was everything as much as I was nothing. My only future was clay as it sifted through my fingers, holding grains of once deer and once primrose, and the fragments of fungi that produce the enzymes to decompose their bodies, giving them new form. Also saying, I can heal, nourish others, and find community in the soils that I am given. The promise of the desert is an offering of healing ingredients. For young people, especially in this past couple of years, I was working with a group of teens, and we had many mental health break sessions where folks wouldn't show up for several days, and just letting us know, like, I'm gonna be real with you, that transphobic legislation, I can't get out of bed. And when we did reunite, it was lovely to try and focus on, like, here is how the mycelium works, or here is like the divine, awesome power of the nature around us. And there's queerness in the nature around us. And there's potential and there's ongoing hope. Even though that might sound trite sometimes, reminding them, but also them showing me with their ongoing spirit that the desert isn't barren. And this is such a large range of age. But for young people, this is our group, especially as a sexual and reproductive health unit. So thinking about their wellness journey, right? Like trying to bring that divine inspiration, knowing that this too will pass, that, the same structures around them have become these eroded towers that we see, that these rocks have fallen, and so shall these barriers. It can honestly feel like they have to move mountains to get to wellness. But as an interventionist, trying to find the ways that we can break down the transportation barriers, the shame barriers, thinking about the questions that they come with from their education spaces, that sometimes youth are perceived to know it all about sex. And I will tell you, it is not true. We are not hip, we are not cool just because we have words to describe them in fun ways. We still need to have these questions answered honestly and factually. It's okay if you don't feel comfortable saying blowjob immediately to a 16-year-old, as long as they know what a blowjob is. If we're talking like, oh, that's oral, great. Because a lot of students do not get that in their health experiences here. And so working with young people, we honestly go over a lot of terms of like, I had no idea that is the same thing as that. Or like muffing, I've never heard that term. And so we just get to go through a lot of fun of what is the health education that has been blocked from them, but also what potential this comes from. And as peer educators, they know more than me that when they tell one person and provide that support to another, they are more trusted than when I come to a room and speak with them. And so we try and make a space with our youth programs that embody reproductive justice, holding all of these subsequent and concurrent elements of reproductive justice. A lot of our teens and young people are interested in these issues, and tying it back to saying that there is power in all of this, and holding your power and fighting for your rights in this area is reproductive justice. It's also environmental justice. It's also economic justice. It's immigration justice. And among a generation that is so activated, it can really be a touchstone for them. And on the back end, how we can make programs that embody reproductive justice comes from having equity-oriented programs, really understanding, okay, if this person is having to come miles and miles and they get to our clinic only to see that the only people on the flyers are cis able-bodied white women, and it's all pink. And they, as a trans mask, need to come in and get their IUD replaced. Are you fronting or loading on as you enter that I'm going to be misgendered throughout this entire experience? This was not made for me. Okay, when I talk about my experiences of pleasure, that might not even be on the radar of the folks here. And then in particular, thinking about community engaged, there are so many awesome little programs that have popped up in different places, and I just want us all to be connected and together. One program that I've mentioned a few times is the Teen Council Peer Health Education Program. Has done fantastic work within this region because in Utah, you can't respond to questions that are outside of curriculum, but the teenagers can. And so knowing that this is a barrier, students want to answer these questions, we teach them, we develop the programs, then we can really move forward. So this was me, again, as a little teenager, a little gaby, as I like to call myself. And I really got into this work within Teen Council, providing sexuality education classes, speaking about pleasure, really making it concrete, dragging my brother to these courses. And then when I came to be an undergraduate, I kind of hoped, I know it's not true, but I kind of hoped like, oh, I'm 18, I will know everything now. And then I won't have to advocate for this anymore. It'll just work out. Also, to be fair, it was of the time. I was like, I'm with her, everything's gonna change. But it did not. And so as I worked as an undergraduate research assistant with the Highly Effective Reversible Contraceptive Initiative, also known as HER, who worked to provide free reversible contraceptive access to over 7,000 folks within the Salt Lake region, it was really interesting to see these barriers keep popping back up. And I had some fantastic folks, a few of whom are in the audience today, who were like, what is this block and barrier to contraceptive access like for young people attending school? And to be honest, I had no idea. I wish I could have been like, here's what's going on. But you know, young people can't all speak for the collective. And so we started this study doing lots of outreach and collaboration, hosting informal sexpert breakfasts. College students love a good free breakfast. And so we would invite different folks who were doing research, doing advocacy. We had a fantastic meeting with the folks from Mischievous Sex Shop nearby, going over all different forms of pleasure and experiences. And you know, got a little bit cut off by COVID, one could say. But in the middle of this, we were kind of looking at how we could make a assessment that goes beyond the youth tools that we have right now. YRBS, right, goes up to 18 years old. And also, let's look at that youth risk behavior survey. Nothing about fun in there. Like nothing about, do you feel like you can access birth control? No. Okay. But also we have the ACHA. Many colleges participate in it, but only 70% of young people go on to college after their high school experiences or their high school years. So, right, we're still not capturing a significant portion of the population. So we made this tool, and it's not perfect, and it definitely needs some refining, but it was really innovative in the sense that we got folks from all different disciplines to establish questions about their knowledge around puberty, self-care, pleasure, intimate relationships, reproduction, desire and sexuality, and ask these young people, what's going on? And it was really insightful because up till 2017 in Utah, there was no education about queer or trans experiences in sex ed. as you might know, it was once called No Promo Homo, and now it's coming back in a new, uglier form. But especially for our queer folks, for our students of color, like looking at how if your experience is not in your education, what interests, what behaviors do you have? So this is like a quick little mock-up of our student population. We had all of those fun demo datas. Most, about 75% grew up in Utah. We had more gender diversity than what was reported in the National College Health Assessment, which until 2019 did not capture gender diversity. Everything was very, very binary. So working within this space as a young adult researcher, it's like you have one tool that captures some of the information you need, and this tool captures only harm reduction, but has all the people you need, but also is in a binary. So breaking down and making your own assessment is not fun. I don't recommend it, but it seems like it is a tool that we need. So we had this population of whom 60% of students participated in high school in Utah receiving abstinence-based sex ed. Not to mention abstinence-based stress that stressed abstinence until marriage as the most effective way to prevent pregnancy and STI transmission. And of these students, 70% of them, 70% of the whole student body said that they wish they knew more about sexual and reproductive health. A little bit less, like 64% said they wanted to know more about birth control specifically. And since I was coming from a family planning space, that was a pretty high concern. But then diving in further, we kind of looked at how our students accessed methods, and most were able to access their preferred method, which was really awesome. We found that 69% of students had used a form of birth control in the past 4 weeks. And like the most common ones were the pill, abstinence, and IUD. IUDs are definitely higher, more highly desired in this population. But when we looked at the awareness of the laws around contraception and SRH, that definitely varied. At the time, this came out in 2018. So we found that 60% of our population knew that abortion was legal in Utah. At that point, up until I believe it was about 23 weeks. But when it came to other laws, we had a pharmacy accessibility law that made it so that folks could get their contraceptive method from a pharmacy. We only had 20% of folks knowing it, but they were like, I would totally use that. 80% said that they would use that method if it was available to them. But I think what I really get excited about is thinking for our folks. Most of our students said that they were sexually active, which definitely comes with some bias of being a sexual health survey. And we were also saying, would you be interested if we expanded access to sexual health care on campus? So possibly, I definitely want to be there. So I'm taking the survey. We had very similar reports to NCHA about our sexual behavior, nothing like totally different. But when it came to their use of methods, the most highly accepted were IUDs and implants. People didn't love abstinence. Some people felt like they had to be abstinent. Withdrawal was also pretty common, but also not the most favored or most confident, to prevent pregnancy. But then we see that there's about 1/5 who say that they were not able to access their ideal method. When we asked about their interest in a no-cost contraceptive clinic at the University of Utah, the most popular choices were emergency contraception and IUDs. I imagine both cost and urgency barrier factor in there. But this is one thing that I think about a lot, is that just because students have access theoretically under the ACA, most students said that they felt really uncomfortable with their parents knowing about their services. And I think about how we have a third who reported this discomfort, but also that for a third of that third, that made it impossible for them to get their method. So even though there are access in some ways, what are our confidentiality measures? What are our ways to ensure that our students feel safe, our young people feel safe accessing and interacting with these systems? So we had about, 66% say that they would like to have kids in the future. This is not often a common question that young adults get. Less than a quarter of our students said that they'd ever been asked about reproductive planning in their health visits. And that was really interesting because, folks were saying, I do, but in 5 to 10 years. So we need to support them across those 5 to 10 years. And also, if they aren't able to access and plan how they would like, about 25% of our students said that if they became pregnant in the next month, they would feel unhappy. But then, I feel like I missed one. Boop. And I hope you're enjoying my little ADHD boops. But then 50% of our students said that it would be the worst feeling they could possibly imagine if they got pregnant in the next month. Some folks, didn't have that experience, and that's awesome. It makes you, oh boy. There we go. Some folks didn't have that experience. About 1 in 10 said that their experience would actually be really positive. Folks who are LDS said that they would actually maybe be neutral or possibly happy if they got pregnant in the next month. And so holding that nuance in our programs, understanding that some of our students are experiencing infertility programs, even though there is a lot of push, right, for contraception and access, we also need to hold the full spectrum of sexual wellness there. This also identifies that about 94% of our population said that if they had a pregnancy in the next month, it would impact their enrollment status at the university, which, as a good game player for implementation, that would be really tough to see so many students have to pivot in that way. And while this assessment was helpful, honestly, what it really showed us was that we didn't have enough pleasure-oriented tools in our repertoire. We didn't have enough gender expansive use in our tools. We needed to have more understanding about how one's experience within the sexual education that they have still comes with a little bit of trauma that might take some more time and repertoire building. So broadly, cost, embarrassment, and stigma around sex were our biggest barriers. But then from here, we were able to develop some programs locally that have shown both in evidence and colloquially to support students using the needs that they've addressed. So on some of your tables, there are these little manila folders, and that is a pleasure pack. It looks discreet because it is. That is what any student can order here at the university. Online, you can order it by Tuesday, and we'll have it delivered by Wednesday. There are 10 different pickup locations across the campus. Originally, this idea came from Boston University. They were able to show evidence that it improved not only the education and knowledge of their students, it broke down some feelings of shame, as well as increased their uptake of the methods. And I have a few different ones about. Some have latex-free options, some have the snugger fit, some have a mix of, you have oral dams, internal dams, and we worked with this program to break down a lot of the gendered messaging that comes with these programs, just to say, yeah, it's an internal condom. It goes inside the body, or an external condom, and just reframing that, because if folks don't have the experience of something being called male or female, then we can kind of set that foundation for them. And this program has been fantastic. It survived COVID, I would like to say. It launched in 2020, and it is still rocking now. We partner with folks across campus, and we're hoping in the next couple months to start an analysis, because the University of Utah is the first public campus that has this, not just for residential students. University of Oregon has a fantastic program that's very similar, and we've been in close contact with folks throughout. And most recently, and I think very impactfully, we had a contraceptive care clinic on campus that any student could show their U card. It didn't have to be the person that, so say I go to the university and my partner doesn't, but my partner is the one who needed contraceptive care, they could be covered as well. We tried to eliminate as many barriers as we could, make it as vibrant and educational as we could. And it was an interesting program, because when it ended as a pilot, I had students in my DMs being like, why is the university taking this down? We're like, it's okay, it's okay. We really are going to try and make it a sustainable long-term program. And as with universities, after I graduated, another class of students are working with the Ascent Center to make it an ongoing program within the university. And we hope to see the long-term impacts economically, personally, socially, of how this affects young people as a cohort. So I hope, as you think of young people, there are so many cultural, social stereotypes that come along with them. But thinking beyond that and thinking of a young person in your life, thinking about what it might take to leave work, to leave school in a cost of living crisis, to stop by an STI clinic or a drop-in service, what they're faced with in the marketing, how they're interacted with in the setting of the clinic, but also just an understanding of, like, they're probably just as embarrassed as you are to talk about anything related about sexuality. And that's okay. There is embarrassment because they have lived in a paternalistic system that tells them, hey, you don't know how to take care of your body. You don't deserve to take care of your body. And we as providers and educators get to be the person that's like, no, I respect you. You own all that. Let's talk about your many different options and seeing it as an expanse of opportunity when you can bring in your 10 Ps and just rapid fire go through them, and know that you are helping a young person that's working in this desert of care, and that will have a ripple effect within them. And anyone who's educated to have their information, working with the young people of Teen Council, it is just fantastic to see them in other spaces and becoming professional health educators, because they had the opportunity to be educated, to be trusted, to be heard about their body. And honestly, it's just fun to, like, see folks out and about and know, like, yeah, you are changing the game. I hear you. And I really hope that in the future, I can be a support for another young person who comes up and is like, this is a radical, game-changing, structure-breaking program that we must do. I'm like, you need it? Let's make it happen. So what questions might you have? Yeah, Teen Council. It is a national program offered by Planned Parenthood. Yes, absolutely. What was the council I mentioned? Teen Council is a program for young adults, sophomores and above. It is hosted regionally, so a state doesn't have to, like a school doesn't have to offer it. But within this region, I believe there's 4 different ones. There's a East Side, West Side, Salt Lake, a Summit, Wasatch County, And we've really tried to make a Utah County and like a Cedar City group. I know that there are some other similar groups, but there's a growing movement as well for peer health education programs on college campuses too. So those are a few allies that I like to bring in. Whenever we have like education sessions, I'm like, how about you teach? And it's a great opportunity, and they're great people. Their TikTok's really good too. I can repeat it. Yeah.
So like we know that this group of young people age 16 to 26 are often the highest risk for STIs and HIV acquisition as well. Something that we've run into at the Utah AIDS Foundation is like, how are we working to educate these young people in this kind of climate where parental surveillance is really intense, and even in like public schools, sex ed, parents have to opt in, right? And often opt out. So how do we reach these young kids with a sex positive, queer friendly education, navigating the complexities of, not quite being age of consent?
Yeah. Yeah, I think that is one area. There's a poster that is attached in the Whova as an additional resource, looking more at like the policy end of things. And that I think is a big legislative movement, is to remove those parent restrictions. In an ideal world, you would never have to opt in to health education. But of course, there are several states in this region that have that. And so I think tying in young people who are already doing the work in a space like Teen Council, like offering it as just like a meeting or like a workshop, they've been able to kind of skirt around areas where educators like in a K through 12 school cannot. But I definitely think that the confidentiality limits are an ongoing battle that I'm not certain yet, but I know that when we up the ante of like the pleasure and the excitement of our workshops, we get more people than when we're like, hey, please use a condom. And so I think it's a mixture of wearing one hat and having another hat underneath, a wig reveal, one could say, where it's like, this is a pleasure-oriented space, and we're also going to have harm reduction materials, and then also having the space to be like, maybe we don't host this within the schools and find other outlets. I don't know. It's a real battle, but I think the more young people that we can get involved and like say like, this happened to you too. You might not know, but this is the language. So thank you, Mindy.